Women are less likely to speak up and get help for pain, but you don't have to suffer in silence. I'm Lindsay Littman with your latest health news. Researchers are trying to raise awareness about pain management for women who might be suffering. A new study found that in some cases, alternative therapies like a rose oil massage for menstrual pain and yoga for back pain work well. If you're about to give birth, it's good to know that women who listened to music during labor had less pain, and their babies had better heart rates. So if you're a woman in pain for any reason, don't grin and bear it. Ask your doctor if there's a treatment that can help you.
Did you know drinking a couple of cups of Joe can reduce your risk for Alzheimer's? It's true. Studies show that compounds in coffee, like caffeine, actually have a protective effect against mental decline. You see, caffeine can actually reduce the buildup of plaque in your brain and lower levels of inflammation. Cheers.
Amoxicillin is a prescription medication used to treat certain bacterial infections such as pneumonia, bronchitis, gonorrhea, and certain types of ulcers. It can also treat bacterial infections of the ear, nose, throat, urinary tract, and skin. This medication belongs to a group of drugs called penicillin antibiotics, which work by blocking the growth of bacteria. Amoxicillin comes as a capsule, tablet, chewable tablet, oral suspension, or oral pediatric drops. This medication is usually taken up to 3 times daily with or without food. Common side effects include nausea, vomiting, diarrhea, and headache. This medication is only to be used if prescribed by your healthcare provider. For RX Wiki, I'm Lindsay Morrison.
Are you ready for flu season? It's already upon us and many Americans haven't properly prepared. A few simple steps can get you and your family ready to take on the flu. I'm Erin White and this is a health feature. The National Foundation for Infectious Diseases, or the NFID, recently conducted a survey to see what Americans were doing to prevent influenza and stop its spread. The survey found that few people got vaccinated in advance and even fewer contacted a healthcare professional for treatment. The flu is treatable, however, and you can take steps to prevent its spread. Dr. Bridget Boyd, a pediatrician and child safety expert at Loyola University Health System, noted in an interview with Daily RX News that it may be easy to be distracted during the holiday season, but remember to take care of your health. Influenza can make you slightly sick or be a life-threatening disease. Caused by viruses, the flu tends to change slightly each year as viruses mutate or different strains become stronger. Flu vaccinations are recommended before flu season starts to help people build immunity. But the NFID survey found that 41% of those surveyed didn't get a flu vaccination until after the flu appeared in their area. Some strategies may prevent the flu. If possible, avoid people who are sick. Wash your hands frequently. The NFID says that everyone 6 months of age or older should have a flu shot every year. If you think you have the flu, see a healthcare professional. Flu medicines are most effective if taken within the first 48 hours after symptoms appear.
If you love reading before bed, you may want to read those classics on a classic paper book and leave the e-reader on the charger. I'm Miranda Savioli with your latest health news. A new study found that people who read e-books for about 4 hours before going to bed had more sleep issues than those who read printed books. The researchers found that those using an e-reader had lower levels of the sleep-regulating hormone melatonin, took about 10 minutes longer to fall asleep, and spent less time in REM sleep, which is important for restfulness. This study focused specifically on electronic reading devices that emit light, such as iPads. Talk to your doctor about taking steps to improve your sleep.
Depression can take all the fun out of being a new mother. Researchers are trying to find better ways to diagnose the problem early. I'm Shelby Cullinan with your latest health news. Postpartum depression, which means depression after pregnancy, affects 10 to 15% of women. Although postpartum depression is a well-known complication of pregnancy, the exact cause is unknown. A new study found that women whose depression started during pregnancy face the highest risk of severe depression, whereas women who became depressed after the baby was born typically had less severe postpartum depression. Speak with your doctor if you have any feelings of depression.
Are you trying to get to the core of what it takes to have a firm core? The right exercise regimen could help combat those extra inches around your midsection. I'm Miranda Savioli with your latest health news. A recent study looked at whether aerobic or strength training exercise was best for preventing abdominal fat gain. After comparing the exercise habits and waist measurements of men over 40, researchers found that strength training was tied to being fitter around the midsection. Although the men who did cardio lost more weight overall, they lost muscle along with their fat. This led the researchers to conclude that among middle-aged men, strength training was an effective way to maintain healthy body composition. Talk to your doctor about creating a personalized exercise routine.
Did you know that the kitchen sponge or even the dish rag is the germiest item in your house? The health and safety group NSF International tested 30 different household items, and it found that the dish rag or the kitchen sponge is the germiest and has the most amount of bacteria on it. Couple that with the fact that you probably use those items to clean off your plates or maybe even your coffee mug, and you might have some issues. It is suggested that you replace your kitchen sponge every 2 weeks.
They are mostly black and white and packed with information. But what good are they if we don't understand them? I'm Rochelle Grossman, and this is a health feature about how to decode food labels. Let's talk serving size to start. Some foods claim to be only 100 calories, but really, that's only because the serving size is very small. You can easily use your hand as a guide. The size of an adult fist is about a cup or a serving of dry cereal. Your thumb is the size of a tablespoon, and your pointer finger is about 1 serving of cheese. Calories often get a bad rap, but calories give us energy. According to the USDA, women between 31 and 50 who exercise less than a half an hour most days should be eating around 1,800 calories a day. It's 2,200 for men, and those older than 51 should reduce their intake by 200 calories. A big part of the nutrition label is filled with bolded names, numbers, and percentages. The first block are nutrients we eat too much, like cholesterol, fat, and sodium. So the FDA recommends you limit your consumption. Below these are vitamins and minerals, and to the right is the percentage of their daily value. This tells you how much of your nutritional needs are met if you eat the serving size. Advertisers sometimes use flashy claims. Here's what they mean. Calorie-free foods have fewer than 5 calories per serving. Fat-free foods contain less than 0.5 grams of fat in a serving. Low-calorie foods have fewer than 40 calories, and low-fat foods have fewer than 3 grams of fat. Let's talk ingredients next. If you see a name that ends in OL or OSE, think of it as another name for sugar, like sorbitol or glucose. Malts, nectars, and high fructose corn syrup can also refer to sugar. Salts may be listed as sodium benzoate, disodium, or monosodium glutamate, MSG. Finally, watch out for partially hydrogenated oil, which is another name for trans fats. You may see different types of preservatives or gums in your ingredient list as well. Some preservatives prevent bacteria from growing or help food last longer. Some acids preserve food colors, textures, or flavors. Xanthan gum usually comes from plants and is often used to thicken food. Gelatin does too, but it's made from animal byproducts. Be sure to look out for food dyes and colors too, and remember, if and when you are concerned about something being good for you, remember that oftentimes the shorter the ingredient list, the better the product may be for your health. You can always check with a dietitian.
Osteoporosis is a condition that involves the thinning of bone tissue and the loss of bone density over time. This causes the bones to become brittle and break easily. Treating osteoporosis usually requires a combination of medications, vitamins such as vitamin D, and minerals such as calcium. Although bisphosphonates such as Fosamax and Boniva are usually first line in treating and preventing osteoporosis, some patients may need other treatment options. Lifestyle changes are often recommended and include quitting smoking, weight-bearing exercise, and avoid caffeine and carbonated beverages. For patients who may need an alternative treatment to those medications available on the market, can benefit from hormone replacement therapy or testosterone. If this is the case, your compounding pharmacist can prepare these medications in a variety of formulations that can help you keep your bones healthy. In addition, your compounding pharmacist can provide you with the appropriate nutritional supplementation by compounding vitamins such as vitamin D and certain minerals for you. If you require compounded medications as part of your treatment for osteoporosis, your pharmacist will work closely with your doctor to determine the best treatment for you. Talk to your pharmacist about how he or she can help you keep your bones healthy.
Did you know being raised in an emotionally stable home where parents teach kids to exercise, control their emotions, and interact well with others can contribute to heart health later in life? A recent study shows that kids raised with healthy habits have healthier hearts as adults. They're also less likely to smoke or have high cholesterol.
Office workers and couch potatoes may have one thing in common. Experts say they both need to stand up for their health. I'm Rochelle Grossman with your latest health news. Research shows that sitting for long periods of time can increase your risk for developing heart disease, cancer, and diabetes. And while exercising on a regular basis can help, it may not always make up for the damage that sitting too much can do. So experts say patients who must sit down at work can reduce their damage by getting up for 1 to 3 minutes every half hour when they are seated for long periods of time.
Wear sunscreen, stay inside during the hottest parts of the day, and refill your coffee? Sure enough, that 4th cup of joe has been tied to lower rates of an aggressive type of skin cancer. I'm Shelby Cullinan with your latest health news. Melanoma is the 5th most common form of cancer in the U.S. In fact, there were around 77,000 new cases of melanoma in 2013. A new study found that people who drank 4 or more cups of caffeinated coffee per day were 20% less likely to get melanoma than people who did not drink coffee. The researchers suggested that compounds in coffee, such as caffeine, could play a role in reducing melanoma risk. This news gives you more reason to hydrate on coffee all day long to help protect against melanoma.
What does striking the warrior pose or moving into the downward dog position have to do with your health? I'm Rochelle Grossman with your latest health news. Well, new research shows these yoga poses may be as good for your heart as biking or brisk walking. A new study found that people who performed yoga showed good improvement in heart disease risk factors like weight, body mass index or BMI, and blood pressure. They also showed improvements in cholesterol. Researchers say the reasons why are still unclear. Yoga involves a series of stretching poses, and experts say it may be a good alternative for those with musculoskeletal problems.
Did you know your job could be putting your health at risk? It all comes down to how you sit. The Mayo Clinic lists slouching as one of the major causes of back pain from work. So take note. Are you slumped over? This position could cause muscle fatigue, stretched ligaments, and strained spinal discs. So practice good posture for pain relief.
DPP-4 inhibitors, also known as gliptins, is a class of medications that are commonly used to treat diabetes. Gliptins work by preventing the release of glucagon, a naturally occurring substance in the body that raises blood sugar. Gliptins share a few common side effects, including nausea, headache, minor skin rashes, and cold-like symptoms. These side effects are usually mild.
Some examples of gliptins include sitagliptin, the generic name for Januvia, and linagliptin, the generic name for Jadinta. Talk to your doctor or pharmacist before starting a gliptin, as they can sometimes cause low blood sugar when not monitored properly or taken with certain other diabetic medications. Make sure to ask about early warning signs of low blood sugar and how to prevent it. It is always a good idea to ask questions about your medication if you are unsure or if you experience something out of the ordinary. For more information on this medication and all other medications, explore the RxWiki Encyclopedia on the web or on your mobile device.
Ready to quit smoking for the new year? It may not be easy, but it's doable. You don't have to take on quitting alone. You can arm yourself with knowledge, options, and help from health organizations. I'm Shelby Cullinan, and this is a health feature. A key first step in quitting smoking is understanding why you feel like you need that puff so badly. It's the nicotine. Nicotine is the primary addictive chemical naturally found in tobacco products like cigarettes. Once your body gets used to nicotine, it needs more and more to feel satisfied. When your body doesn't get enough, you may feel intense and get uncomfortable cravings, which is called withdrawal. Knowing your triggers can help you create an action plan to avoid them. You can spend more time with non-smokers or go to places that do not allow public smoking. The National Cancer Institute says that medications can lower your feelings of withdrawal and cravings. One medication that reduces symptoms of withdrawals is nicotine replacement therapy. E-cigs may also be an option to help smokers. Studies show that e-cig users were less dependent on nicotine than those who smoked conventional cigarettes. Smokers wanting to quit should also reach out to family, friends, and support groups for help with the quitting process. Whatever method you choose this new year, know that there is help and support along the way. If you need help quitting smoking, ask your doctor for different methods on how to succeed in the process.
Too many parents are jumping the gun when it comes to car seats. I'm Lindsay Lippman with your latest health news. You might not be breaking a law, but if you face your child's car seat forward before their second birthday, you might be putting them at risk. New research says that most parents turned the car seat around before their child turned 2. The American Academy of Pediatrics says children should be in a rear-facing car seat until they are 2, or if they've outgrown the height and weight limits of their car seat. There are several reasons why parents may choose to seat the child forward-facing, like being able to see what they're up to or making it easier to get the child in and out of the car. If you aren't sure if your car seat is positioned safely, go to safercar.gov to find a child safety seat inspector in your area.
By now, you've seen the labels, know someone, or perhaps tried it yourself. The gluten-free diet. Gluten-free has become big business, but before you march on down to your local supermarket, take a little time to learn about gluten and how it can affect you. I'm Rochelle Grossman, and this is a health feature. Gluten is a protein difficult for some people to digest. It's found in grains like wheat, barley, and rye, but it's also added to foods to improve taste and texture. It can be found in cookies, French fries, salad dressing, soups, even food additives like malt flavoring and modified food starch. The most common and potentially life-saving reason to go gluten-free is to treat celiac disease. Celiac disease affects about 3 million Americans and results in intestinal damage. Over time, the digestive tract can become so impaired that nutrients are poorly absorbed, leading to malnutrition, cancer, and bone loss. New FDA rules require any product labeled gluten-free must be naturally free of gluten, or that any gluten presence must be less than 20 parts per million. Naturally gluten-free foods include eggs, seeds, beans, unprocessed nuts, meat, poultry, fish, fruits, vegetables, and most dairy products. With close to $9 billion in sales so far this year, a lot of people are trying to eat gluten-free. Some think the diet is healthier, others believe it can help them lose weight. But gluten-free does not mean fewer calories. And cutting out certain grains may result in nutritional deficiencies since many packaged foods containing gluten are enriched with B vitamins, iron, calcium, and magnesium. Plus, it's costly since many packaged items are more than double the cost of regular foods. In short, before committing to any specific diet, meet with a registered dietitian to determine the best and safest diet for you.
Did you know that working too much might drive you to drink? Studies show that people who work longer hours are more likely to have risky drinking behaviors. For this study, that included 14 or more drinks a week for women and 21 or more drinks for men. Those who work more than the standard 9-to-5 job are 11 to 12% more likely to display risky drinking behavior, which could lead to many health issues, including liver and heart disease, as well as increase the risk for stroke. Good.
An ingredient in your breakfast cereal may be preventing birth defects all across the U.S. I'm Erin White with your latest health news. A new study from CDC researchers found that since fortifying products with folic acid became a national health policy, rates of serious birth defects have dropped. Neural tube defects are birth defects occurring in the spine, spinal cord, or brain of an unborn child. One common neural tube defect is spina bifida, in which the spinal column doesn't completely close. However, the B vitamin folic acid may help prevent these conditions. Speak with a doctor to make sure you're getting enough folic acid in your diet.
We've all come down with a case of the Mondays at some point, but could your job really be putting your health at risk? I'm Miranda Savioli, and this is a health feature. Your company may offer you health benefits, but could that desk job be causing you to need them? Long commutes in your car, sitting all day, office snacking, stress, lack of sunlight, staring at a computer, caffeine addiction, risk of depression, and overtime can all seriously affect your health. These factors, combined or independent, may lead to an array of health problems ranging from eye strain to an increased risk of heart disease or certain cancers. While you can't quit your job, you can take small steps to reduce these risks. Start by limiting snacks to 200 calories and don't drink more than 3 cups of coffee a day. At your desk, maintain good posture and make sure there's sufficient lighting. And, as always, try to follow general health recommendations, like eating a balanced diet and exercising at least 3 times a week.